to start. Good morning, everybody. Thank you for joining us this morning. My name is Luigi Del Puerto. I'm the associate publisher and editor of the Arizona Capital Times. The Arizona Capital Times is, people like to refer to us as a non-ideological, non-partisan independent newspaper. I kind of refer to ourselves as an equal harassment newspaper. If you don't have a subscription, let me know. I'll get you squared away. We have a pretty big subject this morning, but first I want to thank our sponsor for sponsoring and engaging with us this way. The sponsor of today's Morning Scoop is the Center for the Future of Arizona. The center brings together Arizonans to build a bright future for our state by advancing the priorities that Arizonans say matter most to them and to their future. Mental health, of course, is an issue that affects all of us, and mental health is a key focus of the center. CFA hopes that through this morning's conversation, the state's policymakers and our viewers will hear from a diverse group of experts that should be a part of a broader dialogue to create ongoing partnership, and that this forum will encourage coordination among key policymakers, regional community leaders, cross-sector experts on how to tackle mental health from a holistic, long-term, and sustainable approach. Again, thank you, Center for the Future of Arizona. At this point, allow me to introduce Dr. Sybil Francis. Dr. Francis is a founding member and president and CEO of the Center for the Future of Arizona. As I mentioned, a nonprofit, nonpartisan organization that brings Arizonans together to create a stronger and brighter future for our state. For more than 3 decades, Dr. Francis has been a dedicated public policy architect who is committed to advancing innovative solutions to societal imperatives. Welcome, Sybil. Please share with us more about what the Center for the Future of Arizona does and what it is.
Thank you so much, Luigi. Well, I want to just start off by saying congratulations to the Capital Times and to you for this really impactful Morning Scoop series, bringing thoughtful people around important issues for our times, which is certainly near and dear to our heart at the Center for the Future of Arizona. I think it's even more critical than ever in light of all the challenges that we're facing. We are really pleased to be sponsoring this series of Morning Scoops. Prior ones have included addressing the digital divide and challenges to access to broadband in rural areas. One of the upcoming ones, I hope it's okay, Luigi, to give a little sneak peek, is to look at it and bring together some experts and thinking about how do we close learning gaps for school-age children that have been created by the COVID epidemic and working at home and studying at home. CFA's mission, as you said so well, Luigi, is to bring Arizonans together to create a stronger and brighter future for our state around what matters most to Arizonans. And that's certainly more important than ever today, to be coming together in various ways, and this is certainly a very important one. Basically, what we do is we listen to what matters most to Arizonans, and we have different ways of doing that, including an upcoming statewide Gallup survey of what matters most to Arizonans and what they think is most important to the future of our state, the second only that we've done in the last 10 years. So I think we'll be finding some really interesting information out of that. We share trusted data about how Arizona is doing in those priority areas identified by Arizonans. Some of you may be familiar with our progress meters that allow us to report on how we're doing. We bring critical issues to public attention, and I think this forum is certainly one example of how we go about doing that. And we work with communities and leaders across the state to solve public problems. So more than a think tank, we're a nonprofit, nonpartisan do tank. And we like to emphasize the do because yes, we do research into what Arizonans believe, but we are also out there ourselves working across our state with schools, employers, and others in making things happen. And certainly one area of special focus is our young people. They are, after all, going to be the leaders of our future, of our state. And most recently, we've been completing a survey of young people, which is very timely, and certainly top among the issues that they're concerned about are things like housing costs, job opportunities, and career mobility, childcare and education, certainly their own education as young people, but also the education of their children. But among the top issues and of growing concern for them and for all of us is in the state is our youth's mental health. I think this was already a growing issue before COVID, and certainly like many things, I think COVID has brought out some of these kind of systemic issues that we're facing, and in some cases has really magnified them. So I think this topic is really timely. I'm so grateful to the experts and the elected officials who are here today to share their expertise and what they've been working on to help address this issue. So with that, I thank you all, and I turn it back to Luigi. Thank you.
Dr. Francis, thank you again. And Dr. Francis mentioned Morning Scoop that we're doing. That's next month, and we're going to be talking about how to close the learning gap. A lot of us are working from home full time and also kind of homeschooling our kids full time. So thank you again, Dr. Francis, and thank you very much to the Center for the Future of Arizona.
I'll go join as a participant now. Thank you.
Thank you. Bye for now.
Bye.
We have a great panel this morning. Joining us is Senator Kate Brophy Mcgee, who represents Legislative District 28. Senator Brophy Mcgee is the chairwoman of the Arizona Senate Health and Human Services Committee. She authored this year's Health Mental Omnibus Bill, also known as Jake's Law. As I mentioned earlier, a monumental legislation that, among other provisions, requires health insurers to cover mental health, just as they would physical health care. Senator Kate Brophy Mcgee previously served in the Arizona House, and she once described being a moderate as the, what's the phrase, miserable middle?
Yes, yes.
Thank you for joining us, Senator Kate Brophy Mcgee.
Thank you. Sometimes I think of it as the magnificent middle. It's a pleasure to be here, and thank you very much to Dr. Francis and the Center for hosting this.
Thank you, Senator. Also joining us is Senator Sean Bowie, who represents Legislative District 18. Senator Bowie is a member of several panels, of course, notably the Senate Appropriations Committee. Last year, he was the lead author of legislation that required school districts and charter schools to provide training in suicide awareness and prevention for school guidance counselors, teachers, principals, and other school personnel who work with students in grades 6 through 12. He has worked as a management consultant, worked with Fortune 500 companies from across the globe, and previously he worked for the provost office at the Arizona State University. Thank you again, Senator, for joining us.
My pleasure. Thank you, Luigi, and thank you to the Capital Times and the Center for the Future of Arizona for sponsoring this forum on what's a really important issue. So thank you.
Also joining us is Eric Marcus. Eric is the executive responsible for social determinants of health programs, including housing, employment, criminal justice, and food security at Health Choice Arizona, a regional health plan organization, and the Northern Region's Behavioral Health Authority. Previously, he served as a senior executive with the NARBA Institute. He has served as a Fortune 500 company chief technology and chief information officer. He's the author of an award-winning business strategy book called The Digital Alchemist. He's an internationally known speaker and has been a guest lecturer at major universities. He has also served as a city council member and is currently the president of the Cottonwood Oak Creek School District Governing Board, where he is from, he's live streaming from right now. Eric, thank you for joining us.
Luigi, thank you so much. Thank you to the Arizona Capital Times and to the Center for the Future of Arizona. I think this is such an important topic. Glad to be here.
Also joining us is Dr. Heather Ross, PhD and DNP. Dr. Ross is a special advisor to the Office of Phoenix Mayor Kate Gallego. She's a practicing nurse. She holds joint appointments in the Edson College of Nursing and Health Innovation and the School for the Future of Innovation in Society. She advises Mayor Gallego on a number of healthcare issues, including behavioral health and public safety, making Phoenix a dementia-friendly city, creating a 24/7 rape crisis center, of course, curbing the current and future nursing shortage in the city, as well as on managing the COVID-19 pandemic. She also holds a national certification as an adult nurse practitioner and maintains an active practice in cardiac electrophysiology. Did I get that one right?
You did. Thank you. And thank you very much for inviting me to be with you this morning.
Thank you. And finally, also joining us is Dr. Sharay Ghani. Dr. Ghani is the Vice President and Medical Director for Magellan Healthcare. A diplomate of the American Board of Psychiatry and Neurology, he began his career in inpatient psychiatry and worked as a consultation and liaison psychiatrist for many years. He has also worked as a psychiatrist in traditional ambulatory care settings and in urgent care, psychiatric care environments. He previously served as the Chief Medical Officer for Magellan Health Services in Phoenix, Arizona. He has a telepsychiatry practice in the state. And you just heard my dog bark at something or someone, so I apologize for that. Dr. Ghani, thank you for joining us.
Thank you, Luigi, and glad to be here and looking forward to participating in this important discussion.
And to our viewers and to our listeners, I encourage you to ask questions. Send in your questions via the chat room or via the Q&A room, and we'll try to get to as many of them toward the end of the program. So again, thank you. Let's talk about Jake's Law. Jake's Law requires, among other things, health insurers to cover mental health care just as they would physical health care. Of course, the overarching goal is to expand access to mental health care to our children. Let me go to Senator Kate Brophy Mcgee. Ma'am, what was the situation before Jake's Law, and how did Jake's Law change the landscape?
So I'll speak to the situation legislatively and let the real experts talk about it on the ground. This has been a subject, suicide has been a subject, behavioral health has been a subject that has been bubbling and percolating down at the legislature ever since I've been there. And thanks in large part to the work of Senator Bowie and others, it has moved to the forefront. As I explained to a parent who emailed me from Tucson about Jake's Law, it will take some time to implement. Pulling down the federal parity law and implementing it at the state basis and holding insurance companies accountable for treating mental health issues exactly as they would physical health issues is a process that will probably take through 2021. There were many ancillary pieces to the law. That's why it was called an omnibus bill. It had very many different provisions, and some of those will come online sooner than others. I'm very, very proud of the suicide mortality review team. Our mortality review teams housed at the Department of Health Services do great work. Probably one of the smaller components, but really important components, was to have the Department of Insurance number on the back of an insurance card so you could call and get information about your plan and what it covers. It seems like such an inconsequential thing, but as the parents who brought me this legislation will tell you, and other parents, Ben and Denise Denslow, whose son unfortunately completed suicide at the age of 15, when you are a parent in stress and trying to get help for your child, you immediately become lost in the process. So Jake's Law is underway. Parts of it can be implemented now. Parts of it are going to be implemented over time, concurrent with the cycles, the financial and plan cycles for health and insurance companies. And the $8 million bridge fund, I think, will also be immediately available to uninsured and underinsured kids to ensure they get the help that they need. There are just so many excellent components in this bill. I would like to give Senator Bowie a shout out for the counselors provision, the $20 million that made it into the budget the year prior, that is an underlying and key component of this. Happy to answer questions.
Thank you, Senator Kate Brophy Mcgee. Senator Bowie, so tell us about this component that Senator Kate Brophy Mcgee has mentioned. How has it been implemented so far, and how, what do you hope to see in our classroom settings as a result of this funding?
Sure, and this was in the 2019 budget. We really had a bipartisan coalition of folks who were responding to a statistic that we have here in Arizona. In Arizona, we have the worst student-to-counselor ratio in the country. On average, it's over 900 students for every counselor. And the numbers range pretty widely. And, in my district, we have some schools where it's 400 to 1, and others where it's, 1,500 or 2,000 to 1. So there really was a need for additional counselors, social workers, mental health support in our schools. And it's something that I saw just visiting my schools. Every 2 years I go out and, visit all my schools and talk to the counselors. Not every school has a counselor. Not every high school has a social worker. So we really saw the need for that. So we were able to get $20 million of ongoing funding. And as you know, Luigi, and certainly Senator Brophy Mcgee knows, it's really hard to get funding for anything in our state budget on a one-time basis, let alone permanent. And that $20 million was permanent funding that we're able to get in our state budget for a grant program for schools to go out and hire more counselors and more social workers. And in the governor's proposal earlier this year, he had a plan to actually increase that to over $40 million. And that was, put aside with COVID-19 and everything else that was going on. So I've heard from my schools on the ground that they've hired more counselors, they've hired more social workers. It's obviously critically important, but we still have a lot of work to do. Even after the first year of the program, our ratio is still almost 900 to 1. So we have a lot more work to do to get more mental health support in our schools once schools are able to reopen. So kids who do need to see somebody, who do need help, have someone they can talk to on a daily basis.
And Senator, yeah, go ahead.
If I could just add to that, one of the ways that we bridge those on-school employees is to contract with our behavioral health providers in the community, because a teacher, a coach, an administrator can identify a child with behavioral health needs, and then through the system that was put in place, we can actually go out to private behavioral health providers like Touchstone, bring them onto the campus and provide that behavioral health, target that child, target that family. One of the things that we have learned is delivering behavioral health services on a school campus is one of the most effective things that we can do. So I did want to make that point. It's not necessary, it's staffing, but it's also access to those services for identified students.
So for school districts, school officials who might be listening, this is grant money, so they can, it's available to them. So they have to go through the grant process. There is some level of certainty that they will get the money, correct?
Yes, it's a 3-year grant, so it's renewable for 3 years. So generally, if they're approved for the first year, they will be able to get it for 3 years. And that's one of the reasons why we advocated for additional funding this year, because we had a lot of schools who applied and did not get accepted. So because the money was renewable for 3 years, if they didn't get it the first year, they were kind of out of luck for 3 years. So that's why, going into next year, we really want to fight for additional funding. So the governor's plan outlined that every school that put in a proposal, they would at least get their first choice for either a counselor or a social worker. So that definitely needs to be a priority for us going into the next legislative session.
So let me go to Dr. Ross. Ma'am, you've seen the mental health situation in the city. Jake's Law was just passed this year. It's going to take its time to get implemented. Again, as I mentioned, the overarching goal is to really expand access to healthcare, especially for our children. But what are you seeing on the ground right now?
So one of the things that we're seeing on the ground is that, and my answer certainly is inflected now with the incredible COVID experience that we're having, and people are really suffering in many ways, and often from home or, with economic stressors that nobody expected prior to 2020. With that said, one of the things that we are experiencing in the city is that there are many, many people who have a very difficult time accessing behavioral health services. Whether or not there is funding available, whether or not they have insurance, or whether public or private insurance. And I was so pleased to know that Jake's Law had the provision to help bridge that gap for people who are uninsured and underinsured, and providing parity. That's wonderful. One of the things that we do know is that the behavioral health system in many ways is broken. We deal a lot at the city level from a public safety perspective, and our police officers and firefighters are often called to engage people who are experiencing a behavioral health crisis out in the community. And there is a wonderful tool that our public safety officers have, where they have just a dedicated intake door for individuals who will consent to going to one of the behavioral health hospitals in the area. It's a wonderful process for our police officers particularly. It is not taking them off the street for hours. They can do a very quick transition for an individual. And then here's what happens. Oftentimes, those individuals are observed in a behavioral health facility for 24, 48, 72 hours. They are stabilized, and then they return back to the community without necessarily having that connection to the longer term chronic care services that they need.
So there's what you're saying is there's a gap in between, so you have a more efficient, expedited process for the police to intake somebody who might be experiencing behavioral health issues, right? And
There's
then
an expedited process at the front end, but then the connection
the back end,
to not even the back end, it's the middle end. And as Senator Brophy Mcgee noted, the middle end can be a difficult place to be. I don't want to suggest that it's not because anybody's not trying, but it's an incredibly complex system. And we are understanding where there are gaps that need to be bridged.
So let me ask Eric. Eric, we've been moving toward an integrated delivery of healthcare, right? Notably through access, in which, and correct me if I'm wrong, you're the expert here, in which physical acute care and behavioral care are delivered under one roof, if you will. Okay, what are you seeing on the ground in terms of how that has improved, access to mental health care? And if you could cite one or two examples.
Luigi, that's a great question. Let me start out by saying that Health Choice, under the name Health Choice or Health Choice Integrated Care, and when we were the Northern Arizona Regional Behavioral Health Authority by name, we've been providing behavioral health for the behavioral health needs of rural Arizonans since 1967. So we've been doing this for a long time. But I really want to recognize Access and the leadership of its directors, Tom Betlak and now Jamie Snyder, for the foresight and vision that they've had in looking at integrated care even before Jake's Law came into play. With Access Complete Care, we've seen a groundbreaking integrated care delivery system that brings together the whole person, so that people with mental illness, behavioral health issues, can be treated by the same programs that are also treating their physical health. And I think this is a really critical issue. We need to look at the whole person, not just part. And Access, which is truly a leader in healthcare across the nation, has done a great job of bringing this forward.
Thank you, Eric. I want to talk about, the COVID-19 and the situation we're in. This
Can
pandemic.
I make one clarification, Luigi?
Yes, go ahead, ma'am.
I'm seeing the questions coming across. Access will provide behavioral health services on the campus at no cost to kids on Access. It's actually, we've been able to identify a number of children who qualify for kids care who are not on kids care. And the Bridge Fund will get them those services whether they need it or not. So there's the counseling component that kicked this whole thing off. But the point being that Access is the gold standard and has led on this issue could not be more accurate. For those schools who need behavioral health services for students, reach out to Access and it will be handled. Those kids who are on commercial plans, private insurance through their families, that's the piece that Jake's Law addresses.
You're talking about the gap because Access already covers children who are under Access, but there are others who are under
Right.
either a private insurance system or don't have one.
Correct. And then there's the Bridge Fund, the $8 million that gets us, while we try and figure out where this child is, what insurance plan needs to be in place, that Bridge Fund gets them the immediate help. So I just wanted to be clear with Senator Bowie's bill that kicked this off, but it's important for school districts to know and charter schools to know they can get that help for those Access kids now.
Thank you. So let's talk about COVID-19. We all know how this pandemic has compelled us to change our behavior. A lot of us have been self-isolating for months. You know, kids, for example, have not physically met their friends for months, which means they're missing out on socialization and all the benefits that accrue from it. You know, many of us are working from home. As I mentioned earlier, I'm working from home and kind of homeschooling my 9-year-old at the same time. Dr. Ghani, you have a telepsychiatric practice in Arizona. What are some of the behavioral problems that you have seen as a result of, well, this prolonged isolation for one, but really, you know, being stuck at home?
Thank you, Luigi. Just a quick comment. There are so many facets to mental health and mental health services that it was taking me back to the time when I was working as chief medical officer for Magellan here in Maricopa County, and access to care, as well as connecting to services after a crisis is stabilized remains a challenge. Coming to your question, with the social isolation, like you pointed out, I'll quickly go through things that one should look out for in teenagers and children. Feelings of numbness, disbelief, anxiety, or fear is a common reaction to the pandemic, which brings risk of possibly catching the infection and the risk of dying, mortality. The uncertainty of where this is going, when will the vaccines and treatments be available? So changes in appetite, energy, and activity levels are things to look out for. Difficulty concentrating is something we are seeing in teenagers, adults, everyone just can't seem to focus and complete tasks. Difficulty sleeping or nightmares, especially in younger kids. There are physical reactions to this. The psychological feelings or thoughts and manifestations are converted into headaches, body pains, stomach aches, and skin rashes. Those are possible manifestations of the psychiatric stress.
I'm sorry, you mentioned skin rashes?
Yeah, so breaking out in a rash, having problems with abdominal pain, body aches that are not, can't understand them, and headaches. These can be manifestations of psychological problems. Anger and being short-tempered. I'm seeing an increase of alcohol use, tobacco, and drugs in the members that I serve. So I do telepsychiatry or video visits, and we're seeing a significant increase in requests for treatment for anxiety disorders, depressive disorders, post-traumatic stress disorder, and alcohol and drug use.
So, Dr. Ghani, so you're seeing some of these manifestations of the challenge that we are in. You're a parent, how do you deal with this?
So tip that I would give for parents, I'm gonna try to keep this as succinct as I can. So things that you can do as a parent to support your child is to take the time to talk with your children or a teenager about the overall outbreak, give them facts, reassure your child or teenager that they are going to be safe, right? This too shall pass, right? Senator Mcgee mentioned previous, as we were chatting before the program started, previous pandemics and breakouts. These things do settle down and pass. We just have to keep our wits about ourselves. Limiting the family's exposure to news coverage of the event, including sometimes social media, it can be a little bit loud. It can be a little bit shocking. So what I like to say is don't go to check the news. Don't let the media or the news come to you and overwhelm. Trying to keep a regular routine for the kids is really hard. My kids, they want to stay up till like 3 or 4 in the morning. If schools are closed, we create a schedule for learning activities. We are all learning that virtual learning is a bit of a challenge, right? It's kind of new for us. So going into this school year, the last semester before the holidays was pretty much scratch. So now we are hoping to do a better job with learning. Being a role model, take breaks, get plenty of sleep, exercise, and eat well. Connect with friends and family, and the children will follow.
Thank you, Dr. Ghani. Let me go to Dr. Ross. Go ahead, ma'am.
Well, what Dr. Ghani is presenting is a wonderful set of recommendations. And I think it's important to note that there has been improved parity for telehealth services as a result that emerged through the COVID-19 emergency. And we hope very much that those telehealth services will persist one of the things that Dr. Ghani is doing is actually a bit of a rarity in Arizona, which is to say providing behavioral health services. And the reason that I say that is that Arizona, the entire state of Arizona, even our urban areas, is federally designated as a medically underserved area for behavioral health providers. We have a shortage of trained professionals, whether it is psychiatrists, psychologists, nurse practitioners, licensed clinical social workers. We don't have the workforce that the population needs in a normal time, let alone the workforce that our population in Arizona needs in this extraordinary time with extraordinary behavioral health stressors on our community.
Thank you.
Add,
go ahead, Eric.
To Dr. Ross's statement. We've been offering telepsychiatry for more than 23 years. It was pioneered by Dr. Sarah Gibson up here in Flagstaff to serve underserved areas like Apache counties and Navajo counties, where it's very, very difficult to find services. I also wanted, if I can just for a moment, build on Dr. Ross's earlier comments about pre-arrest diversion programs. They are absolutely critical. The goal is, if we can keep people who have behavioral health issues out of the criminal justice system, we've done a good thing. And those include literally hundreds of thousands of first responders across the state who have received mental health first aid training, crisis intervention team training, crisis response programs, including the Crisis Response Network and Teros Health and others, and crisis stabilization units across the state. So they are really critical. Dr. Ross is absolutely right.
Thank you, Eric. Let me go to Senator Bowie. Sir, so we approved funding for counselors at schools. That was last year. We passed Jake's Law this year. It's going to take time for those things to implement, and for us to really start seeing the results, the desired results. In the meantime, in terms of access to behavioral health programs, what are you hearing from your constituents? And really, I guess the question is, as a policymaker, what else do you think the state can do on this front?
Well, and like Senator Brophy Mcgee said earlier, the law passed this year, and it's going to take some time to implement, and it's going to take time to educate both individuals and also the broader public about the changes that have been made and the resources that are available. And I think there's still obviously a stigma around mental health, and the more that we can do to educate people, especially in a time of a global pandemic, that this is important and that resources are available. I think additional training for people is really important as well, and that's something we worked on in 2019. We passed a law that is actually going into effect this fall. So now all school personnel, grades 6 through 12, are required to take training in suicide prevention. And that's not just for teachers, that's for support staff, that's for bus drivers, custodians, everybody. Because I think, when it comes to mental health, people want to help, but oftentimes they don't know how. They don't know what to say. They don't know how to approach that issue. There's still a stigma around it, like I said. So the more people that have been trained on this, there are some great resources that are available online that are research-based, that are scientifically based. I think that's really important. And then as far as next steps go, Arizona, when you compare us to other states, states like Utah have really been leaders on this. And there's a lot we can learn from what other states are doing. In Utah, they have state funding for state hotlines, text-based hotlines that young people can text and call. And they have clinically trained social workers who are answering those calls and are talking to those young people. Those are absolutely things that we can do. And then at the district level, people forget our job at the legislature. We approve the per pupil funding for the schools, but it's ultimately up to the school districts to decide how those dollars are being spent. So some districts, especially in the East Valley, where I represent, have done a great job of having counselors in the schools, having resources available on student ID cards. That's another law we passed this year that's going to go into effect in 2021. But some districts are already doing that. So it's partnering with our school districts, partnering with our school board members, and helping them understand how important this is. And then the school districts implementing those policies at the local level, working with Access. So it's not just us at the state capitol working on this. We're in partnership with our local governments, with our cities and our school districts to make these resources available to young people who need it.
So I could also, Luigi, just give an
Go ahead.
example of how that's actually playing out. Here in Cottonwood Oak Creek, 6% of our families are homeless, 11% don't live with either parent, over 85% are on reduced lunch. And what we're seeing is a tremendous increase in the number of students on individual education plans, IEPs. This is as a result of children facing adverse childhood experiences at an alarmingly high rate. We wish we could wave our magic wand and make those underlying problems go away, but we know we can't. What we can do, however, is teach children how better to cope. And so we launched a program here 3.5 years ago called Focus Zones. So instead of a student being sent to the principal's office and then suspended, we send them to the Focus Zone room. And this is a room that was funded by a combination of the NARBA Institute and Blue Cross Blue Shield Arizona, for whom we are grateful. It is staffed by specialists in children's behavioral health. The child comes in and is taught breathing techniques and other skills necessary to be able to cope, and then return to their classroom where they begin their education again. I'll just share one very quick episode. A child was throwing things in the classroom, being disruptive, was sent to the Focus Zone room, walked into the Focus Zone room, and immediately said to the teacher there, "I know why I was sent here," and says, "Assume the shark," and stands up at attention and puts their hands together like this, and then begins deep breathing, and says, "I'm ready to return to my classroom now."
Oh, wow.
Our children want to learn the coping skills. They don't want to be disruptive, okay? And we're giving them that opportunity thanks to these grants, this program.
Thank you, Eric. Just a quick question. How, when you're implementing a new program like this, and when you're trying to change, what has been traditionally the response to schools to, well, for lack of a better phrase, misbehavior, for example, how difficult was it? What was the transition like? Just real quick.
I would just say the most important thing we believe in elementary education are social and emotional supports. That is what is really critical for children to want to learn and to feel safe at school. So we have spent a lot of time working with teachers to develop that compassion and be able to show them how they can, in fact, capture kids' hearts. And that's been the major factor in making all of this work.
Let's talk about suicide. As you know, suicide is I think as of 2018, and I could be wrong, but as of a couple of years ago, it is the 8th leading cause of death in Arizona. And anecdotally, we've heard from some county health officials that the pandemic has exacerbated this problem. Let me go to Senator Kate Brophy Mcgee. Ma'am, what are you hearing from the ground in terms of not just suicide, but suicide prevention, and what are some of the anecdotes that you're gathering from your constituents?
Well, there are two sets of realities. One is pre-COVID and one is during the time of COVID, and it's not good and it's worse. So I'm
sorry, you said not good and then worse.
And then worse. I mean, because a lot of our mandated reporters are not able to see the children or see those who are affected, or in the case of domestic violence, I serve on 3 different commissions related to that. In the case of domestic violence, the victim is home with the abuser and can't go. The genesis of Jake's Law actually started 10 years ago, when family members whose loved ones had committed suicide or completed suicide, as it's called, came down to the Capitol and said, we need to do something. 2 years ago, I had a discussion with the superintendent, Paul Stanton, Washington Elementary School District, in a community garden over on 19th Avenue, and he told me he was dealing with 3rd and 4th graders with suicidal ideations. The paper a couple, 3 weeks ago, had a front page story about an 11-year-old girl who was bullied into committing suicide. So we have a lot of work to do. And to Senator Bowie's point, we have to eliminate the stigma. And I think we can do a lot of that at the legislature by continuing to raise awareness, continuing to bring legislation and initiatives forth that really inform people. One interesting aspect of this is that, sorry, my phone's ringing.
Oh,
One
no
interesting
worries, yeah.
one interesting aspect of this that I think it's imperative that people understand is the affect of children who are depressed and contemplating suicide is very, very different. It's not the same as an adult typically who may be going through this. And I think the experts on the panel can speak to that more. We have a lot of work to do, and a lot of it has to do with educating our community not to stigmatize. I'm all in to make that happen.
Dr. Ghani, go ahead, sir.
Thank you. Thank you, Lizzie. Dr. Mcgee, fantastic thoughts that you were sharing. I want to point out to all of our members that as one burrows deep into, you may ask yourself a question, okay, there is 10 people who are depressed, 3 commit suicide. What is the difference? What is it that makes a person take their life? The answer does remain a bit elusive, but there are, you know, what is the sort of accepted theory across the healthcare arena is that there are 2 components that really expose a person to the risk of suicide, and then combined with some other factors. One is lack of belongingness. I am alone. And the second one is burdensomeness. I am a burden. Those 2 feelings, when they come together, and then there is intent, desire, and capability. And I don't want to go into the details of that, but those are the things that we're trying to get at. You know, Jake's Law and similar strategies and approaches cut to the heart of this stigma. The stigma of mental illness leads to this I am alone, because I'm too embarrassed or ashamed to talk about my thoughts. The pandemic has had a compounding effect on that, right? The social isolation. Our fabric of our society is based on meeting with each other, religious meetings, outings, restaurants, lunches, going to movies, theater, you know, all of those things help us reduce our loneliness.
Right.
So
and hugs too, hugs, which we can't do right now. I mean, that's kind of part of our, that's a really great coping mechanism, and we can't, that's not available to us.
Correct. So what we are talking about is, you know, is how do we get to it? So as we see younger, there has been an explosion of increase in suicides in the 15 to 24-year-olds in the last 15 years, significant increase. So our kids are, you know, a bit more exposed to what's going on around us. So the pandemic brings an extra layer. So I can't quote numbers for you because we do analyze numbers, but there has been an increased amount of overdoses and completed suicides since the beginning of this year.
Yes, and if I may, I know that there has been in the last couple of weeks particularly some statements coming from respected former public health officials and public health officials who are pushing back on this idea that there are more suicides, more people completing suicide. Something that's really important to note is a few points. One, a case of a suicide, that is a case that goes to the medical examiner, and that death certificate and that case, and pardon me for my dog, those cases take a really long time to adjudicate, and so those numbers don't appear for many months. So anyone who says that there is not an increased incidence of suicide during the COVID-19 pandemic, we've only been at this in America for about 5 months. So the data just aren't done yet. Those data, it takes at least 6 months to know. The other thing I'll point out is that our public health officials have been overwhelmed, working nights and weekends to the bone, trying to keep up with the increased data reporting requirements that the pandemic itself has laid on our counties and our state and our nation. And all public health data are running behind. That's something that we're seeing clearly. So it is a grave mistake to pretend like suicide is not a really dire problem in COVID-19.
So let me go to Eric. Eric, so this is a really tough subject, but let's say you're a parent or you're a student and you're having suicide ideations. Like, what are the resources for you? What do you do? If you start to see this in your children, for example, what is the first step? What in your case, what does Health Choice offer? And in your school district, what's the landscape like?
Luigi, first, once those ideations are recognized, okay, and that's an important element. How do you recognize them? How do you know? And that's where mental health first aid training really comes into play. I recommend that everyone who can take a mental health first aid training program, parents, teachers, all first responders. And as I said, literally hundreds of thousands of people have had that training. Then we have excellent resources. We have hotlines. We have CRM, the Crisis Response Network. We can get people to you very, very quickly. And I think those hotlines and those services are far more readily available today than they ever have been. One of the problems, of course, is the stigma associated with it. You're a parent. You don't want to admit that your child has some kind of behavioral health issue because there's such a stigma attached to it. We have to move away from that. We have to recognize that these are brain illnesses, that these are serious medical conditions that lead to these behavioral health issues, and we need to treat them accordingly.
So insofar as the city, Dr. Ross, what's available to you?
As far as the city's concerned, I can tell you that the Phoenix Police Department has been doing some incredible work over the last couple of years in response to rightful critiques about how the city of Phoenix and the Phoenix Police were working with people with mental health and behavioral health challenges. There's a few things. One, every police officer in the city of Phoenix goes through mental health first aid training. Two, there is the opportunity for Phoenix Police, and I think about almost a quarter of them now have that next step up of crisis intervention training. The Phoenix Police also has a dedicated 2 squads of crisis intervention team, which is really important. And really, really important, the Phoenix Police went out to other departments around the country and learned about what other departments are doing with a co-responder model. And that is a model that brings behavioral health and mental health crisis response to the scene at the same time as the police officer and the public safety officer. Now, there are lots of ways to do this, and the department right now is piloting multiple models and doing really meaningful outcome measurements to figure out what's going to work best for Phoenix. Just because it works in Cincinnati or Memphis or Houston or Los Angeles doesn't mean it's right for Phoenix.
I want to talk just real quick about, I'm sorry, Dr. Ghani, did you want to add something, sir?
Not at this time.
Okay. So just a real quick question about mental health beds. And I'll be brief on this one. We have an acute shortage of mental health beds in the state. Is this solvable by funding? Meaning to say, if we just funded in beds, and I have no idea how much it would take to do that, would that solve the problem.
Throwing money over the wall, building buildings, that's not going to solve anything. We have plenty of buildings around. You need the people to work the buildings. And we saw this, if we're going to, you know, talk parity, which I think we should be, we saw this with COVID. We can designate beds as ICU beds when we're having an emergency, but that doesn't mean that we have ICU nurses, and that doesn't mean that we have respiratory therapists to take care of the people. So you can build beds, you can build barracks if you want to, but if you don't have the professionals to give not only that emergency and crisis stabilization care, but then the chronic care that people need to walk through their lives, throwing money at it's not going to help.
And I would add to Dr. Ross's comment to say this is an even more acute shortage of professional staffing in rural Arizona. It is very difficult to get the board certified psychiatric staff, the behavioral health technicians, and the other people that are necessary to really address this issue, especially in rural communities across the state.
So let me ask Dr. Ghani, just one quick question, sir. What is the one thing you can do right now? If you're watching, if you're listening, if you're a parent, if you're a school counselor, a co-worker, what is the one thing you can do right away to help destigmatize mental health challenges?
I think we have to start thinking of that there is no difference between depression and diabetes. So when an individual has diabetes, they are taking insulin or they're taking pills to control their sugar. They openly talk about it, and we all know about it. But if somebody has depression and they're taking antidepressants or going to see a psychiatrist, they don't want to share that with others. So stigma is at multiple levels. We as healthcare providers have stigma towards patients with mental illness. I'll say that openly. Patients themselves, that was the example I gave, have stigma. And then the community at large kind of looks at people with mental illness as somehow weak or not at par with other individuals. So I think to answer your question, Luigi, in one sentence, I would say conversations. We have to continue these type of conversations where we normalize mental illness as an illness. It's not any sort of personality deficiency or a lack of strength or character. It's mental illness is something there's a genetic predisposition for it.
I want to go to the audience questions because there's a lot of them. But before that one, Senator Bowie, you mentioned you were hoping that you would get $20 million more to fund school counselors. Given the situation we're in, just real quick, what are the chances of that happening next year?
Well, it depends on a lot of things. It depends on what the budget looks like next year. Obviously, with COVID, there's a lot of uncertainty about what our revenue numbers are going to look like. But everyone on this call has talked about the urgent need for these services, and I think a lot of our schools, want to have more social workers and want to have more counselors, and they lack for funding. And that gets to a larger discussion about education funding in our state. And the more that we can do at the state level to increase funding for this grant program, the better position that our schools are going to be in to have more personnel in their schools to be able to help their students.
Senator Kate Brophy Mcgee, go ahead, ma'am.
So I wholeheartedly agree with Senator Bowie. I wanted to again point out the difference in the delivery systems with the Access Kids Care model that has been implemented in schools. It involves deploying behavioral health specialists where they are needed. I think one of the good outcomes of Jake's Law long-term will be to see the private insurers with these added requirements will be providing those behavioral health services. Access pays approximately 72 cents on the dollar. And, private insurers pay more. So I think that will bring more money into the mix. I think the more we understand that this is a problem, and we have made monumental strides from 10 years ago, the more we can focus our priorities and our funding on it. And like anything, if we can intervene at the earlier stages, prior to a suicide attempt, prior to a mental breakdown, or then it becomes two things: less costly to the state, but more importantly, it keeps the family together, it keeps the child together, it keeps everybody moving forward, just teaching coping skills instead of having to figure out what happened and why did you try to kill yourself. So there are going to be some very good things coming out of Jake's Law that will, I think, lend to additional behavioral health providers coming in. There was a bill I was watching that came over from the House side that I hope we can address, which is similar to the Teachers Academy, which has moved us to the top, close to the top in the nation for recruiting new teachers. There was a counselors academy, psychologists academy, and I think we could look immediately at doing things like that.
So thank you. Let me go through some of the questions from the audience. I think this one I'm going to ask Senator Kate Brophy Mcgee. What financial aid can be offered to adults to motivate them to become certified as a social worker or behavioral health counselor? There's a pipeline problem and schools cannot find enough counselors. I guess I guess the question then really is this a state funding issue, and what can you do about it?
Well, and I started going down that road with my comments on the last question, and I think we continue going down that road. Tuition waivers, those types of approaches to the many levels of behavioral health providers, from counselors to social workers to psychiatrists to behavioral health techs and everything in between. I think we can put together a package of financial incentives so that in addition to being a great place to live, Arizona then attracts those quality workforce people.
Eric, I think this is a question for you. Can teachers, social workers, and school administrators differentiate between a change in a student's behavior versus a student experiencing a mental health challenge or crisis? What is then required of teachers, social workers, and school administrators to help them when evaluating a student's needs?
It's a very good question, Luigi. We've had to provide specialized training to our teachers, to our administrators, to be able to recognize those situations where more professionals need to be brought in. One of the programs that we've brought in is a program that was developed in Texas by Dr. Bruce Perry called neurosequential modeling. And it has been a wonderful tool to be able to help a small percentage of our children who have been affected in the womb and shortly after birth through exposure to adverse childhood experiences and others. But we work constantly to develop those skills in our teachers and to have them recognize early when to refer to a higher level of care within the school.
Thank you, Eric. And Dr. Ross, I think this is a question for you. So what happens when the individual is discharged? I think we're talking about, the first responder system that you have in place in Phoenix and elsewhere. But what happens when the individual is discharged and there is no follow-up for outpatient services? Would it be possible that the individual does not get discharged until there is an intake completed to an outpatient service facility or services?
I think that, and in no way am I looking to cast blame. What I am suggesting, so in no way do I think that a crisis stabilization hospital facility is just shoveling people back out onto the street without any plan of care. I think what happens is that the plan of care, there is not the workforce to execute that plan of care, to follow up. It may take many phone calls. People who are experiencing behavioral health crisis, even if it's been stabilized with an inpatient hospitalization briefly, are often not in a position to return voicemails or answer the phone or have a phone. right? To schedule an appointment. They may or may not have transportation to get to an outpatient follow-up or an internet connection to access telehealth services. So I think that once again, it's with the best of intentions, but those best intentions have to be accompanied by the workforce that has the capacity to do the intensive work to build those bridges and make those connections for those patients who are in really vulnerable places.
So let me ask the panelists, do you have like maybe just 3 minutes more? I want to get through some of these questions that have been asked. Is that okay? I know we're at 9 o'clock already, but maybe 3 minutes more. Is that fine?
Fine with me.
Perfect. Okay. So Dr. Ghani, I think here's a question for you. I have tried to going to a psychiatrist over telehealth, but they have told me that health insurance might not cover telehealth next month. I guess this is very specific to the individual, right? We don't really know the circumstances behind, what's going on. But what is your experience insofar as insurance coverage for telepsychiatry?
Great question, Luigi. Right now, I'm seeing a lot of flexibility from the insurance companies where they are accepting not only video visits, but they are even allowing telephone visits in lieu of a video visit if the person does not have access to a smartphone or a laptop or computer. Video visits, I think Eric was touching on that, has been around, telepsychiatry has been around forever, but the utilization was never above 5 or 10%. Right now, I can tell you, I look at the claims for some of our Magellan business, and video visits are more than in-person visits right now. So 55 to 60% of the claims are being done through video visits. I expect and I hope that video visits that benefit is never taken away, because this is the way to get access to far-flung areas, rural settings, and weekend and evening visits. I see patients on weekends, I see patients in the evenings, and patients just love the opportunity to see a doctor. And we can do everything on a video visit other than deal with a psychiatric crisis like an acutely suicidal patient. Everything else can be done on a video. Medications can be called in, therapy can happen, talk therapy, psychiatric evaluations, assessments, everything.
I think I'm going to end with this question from Kristen Poland, who is the CEO of Not My Kid. And I'm going to go around and just ask everybody, can you address helping youth and families remotely while schools are closed or not yet in person? So let me start with Eric on this one.
Well, when I talked about the focus zone and our neurosequential model programs and some of our other programs to address child behavioral health issues, I'm happy to report to you that we are doing it both for our learning opportunity students, we are doing it by Zoom, and we are also doing home visits. So we are actually making this work even in a COVID-19 pandemic.
Thank you. Senator Bowie?
Yes, and as we start to reopen the economy gradually, once it's safe and kids are going back to school and businesses are reopening, there are more resources that are available now than there were a year ago. And I think the biggest part of that is just educating folks about the resources that are available to them. We still have great resources like Teen Lifeline that are out there that have helped a lot of kids and a lot of parents over the years. So we're almost playing catch up compared to a lot of other states, and we're passing laws and we're working with our cities and our school districts to get more resources in place. So educating folks about the resources that are available to them, I think, is really critically important, especially during the pandemic.
Dr. Ross?
Sorry, I lost my mute button for a moment. One of the things that I think is so important too is to remember that, and I don't, for so many families, it's, getting kids back to school puts a stressor on the parents. Yes, there are children who aren't in a family environment like that, but for the people the adults at home who are trying to do this incredible work of supporting children to do online learning, with stressors and to be walking through a world. Listen, junior high is hard on a good day. Like imagine, you know, trying to be 12, 13 years old in this really uncomfortable environment. It's really important that the adults also remember that they need to take care of themselves.
Thank you.
I can't help anybody if I'm not okay myself. So you've got to take care of yourself so that you can serve.
Dr. Ghani, the same question, sir.
Luigi, I'm going to answer that with, I've been watching the Q&A and the chat blog, and I do want to just comment on the myth that talking about suicide with a child or with a family will bring it on. That is an absolute myth. It reminds me of when we did not used to do cardiac caths right after a heart attack, because we have to give time for the heart to heal. But now we do a cardiac cath the minute the person has a heart attack and we get them to the emergency room. Similarly, we have to have conversations about self-harm. You have to ask, are you having thoughts of wanting to hurt yourself? That is the key. People are waiting to have this, they're holding it all inside, and it all comes out, and it's a huge pressure relief. It does not increase the risk of suicide.
Thank you for that. Thank you for that.
Question.
Thank you for that, Dr. Ghani. And Senator Kate Brophy Mcgee, I guess you have the last word, ma'am.
Oh, well, thank you. 3 things. First of all, a shout out to Alhambra Elementary School District, whose social worker reached out to Touchstone Behavioral Health and started the ball rolling on the access side or kids care side, Medicaid side of this issue 2 years ago. Access is doing landmark behavioral health work in the schools, and our challenge is to grow that. Secondly, Jake's Law, by pulling in the private insurers and holding them accountable to parity, is also landmark legislation. And we can build on that to improve access to services. And the last thing is to give a shout out to the Madison Elementary School District, whose superintendent has made social emotional well-being the centerpiece of his path forward for the children in that school district. It is a plan for all to model. We are making great strides here in Arizona. We need to make many, many more of them.
And with that, I want to thank again the Center for the Future of Arizona for sponsoring this morning's program. I learned a lot as a parent and just as an individual. Eric, Senator Bowie, Dr. Ghani, Dr. Ross, Senator Kate Brophy Mcgee, thank you so much for your time. And to our audience and to our listeners, I hope you learned something as well. And I guess I'll see you around.
Thank you.
Thank you.
Right, bye for now.
Bye.